The beauty of using diagnostic ultrasound and focused shockwave together means that we can accurately measure the depth of the target tissue, and we can focus in with our shockwave to treat it.
When we're using focused shockwave, it's really important that we target the correct part of the tissue. And to do that, obviously, first of all, we carry out a diagnostic ultrasound. So in this case, for a patellar tendinopathy. By scanning the tendon, we're able to visualize where the exact area of the injury is. We can also rule out other tears or any other issues going on in the tendon. Once we've measured the thickness of the tendon, we can then measure the depth of the target tissue. And what's great about focused shockwave is that you can use the correct gel pad, and it comes with lots of different gel pads, to ensure that we get the correct depth for the focused shockwave. For example, if we're doing a patellar tendinopathy like we are on this client, then we've measured the depth on the ultrasound, and it's generally going to be sort of 5 to 10 millimeters that we're aiming for. And what this particular gel pad allows us to do is to actually deliver the energy to the exact area where we've got the damage in the tissue.
The piezo wave shockwave system is the most accurate, with the highest energy output and the most durable product on the market, and that's why we use it at Complete Physio.